Well, my name is Lucas Hogan, and I'm with United Healthcare, and I wanted to talk to you today about your 2012 medical benefits. Now, I'll be covering a lot of information during the presentation, but your employee packets will have more detailed information in case you have further questions. What you can expect from United Healthcare is excellent service. We want you to have 24/7 access to all the tools and resources, to live customer service agents. If you call into the 1-800 number, you're going to be speaking with an agent that's actually in San Antonio. And we just want you to have an excellent service experience with United Healthcare as a member. Now, just for being a member, you're a part of a large national network. The odds are that your physician that you currently use is in that network, but if for whatever reason they're not, you should have no problems finding one near you. Now, we would encourage you to use a network physician when at all possible so that you can experience the greatest savings to yourself and to the city. One application that's free to you for any of those you have a smartphone or an iPhone, an Android, something like that, is a free application from United Healthcare called Doc GPS. Now, this is a good one to have. Basically, it'll pull up your current position using GPS, and it will direct you to the nearest in-network physician or facility. This comes in handy if you're out of town and you don't have a computer near you to be able to look this up. Just pull out your smartphone. It'll guide you to the nearest facility. Now, some of you are familiar with the health savings account, but I'm going to go into some detail on how this health savings account, or HSA, works compared to more traditional plans. So a health savings account is basically a pre-tax account that is paired with a high deductible health plan. Basically, you use those pre-tax funds to pay for 100% of all medical expenses until you met your deductible. The difference from a traditional account is that you're paying for 100% of medical expenses until you've hit that annual deductible. Now, there's no longer co-pays on your prescriptions or a doctor's office visit, anything like that. You're going to pay the full contracted rate. You do still get the discounts for being a United Healthcare member that we've contracted with those providers. The government sets annual limits on how much you can contribute to a HSA account. For 2012, it's $3,100 for individuals, and it's $6,250 for families. Now, this is important to note because these amounts are actually greater than the annual deductible you'll have to satisfy as the City of Farmers Branch employee. I'll go over why you may need to do that in a minute. If you're over 55 years of age, you can contribute another $1,000 per year. The HSA plan, you can also use your funds out of that account to pay for dental, vision, LASIK. There's certain other procedures you can pay for using those pre-tax funds. So that's one reason you may want to consider contributing more per year than what your annual deductible is. Now, it's important to note that when you do contribute for that year, if you don't use up all those funds during the year, you keep those funds. It's your personal account, it's your own money, and you keep that account for life. So the pharmacy benefit works a little bit different with the health savings account plan. You still do get our contracted discounts with our network pharmacies, but basically when you go to the pharmacy, again, you're not going to be paying a copay. You're going to be paying the full price for the medication. Now, this price that you pay is going to go towards your annual deductible, but it's important to have the conversation with your doctor when you're getting your prescriptions that you're interested in taking generics or lower cost medicine, since you want to make sure that your healthcare dollars are going further. Our pharmacy network is also very large and extensive. You should have no problems finding an in-network pharmacy near you. So I would, again, encourage you to always use those network pharmacies in order to experience the greatest savings for you and your family. So I mentioned having the conversation with your doctor about having the lowest cost medicines. This was traditionally set up between tiers on Tier 1, Tier 2, Tier 3 medications with different copays on each tier. On your plan, there's no copays on these tiers. It's just important to know what prescription you're taking and if there is a generic alternative. So again, you want to always have those conversations with your physician up front. Explain to them that you're on a health savings account, that you're paying 100% for these medications, so that you can have the lowest cost medications and let your pre-tax money go as far as it possibly can. Basically, when you go to the pharmacy with prescription, it still works very similarly. You still take your insurance card to the pharmacy, And for new employees, you want to make sure and take that card initially so that that pharmacy has your new information loaded. And you simply are going to pay the entire cost of the medicine at the point of sale, either from your HSA account or your out-of-pocket money. Now, that medication's cost is going to go towards satisfying your annual deductible. Just taking a quick look at your annual benefits, again, I've mentioned this earlier, but you're responsible for 100% of all medical expenses until you've hit that $2,000 deductible. So now, instead of where you traditionally may be used to paying a $25 copay for the physician, you may be paying something closer to $100. You're still going to get our contracted discount with that physician when you go in network. But now that $75 or whatever you're going to be paying for an office visit is going to go towards satisfying that annual deductible. So this includes any emergency room visits, any prescriptions, any doctor's visits. All of that is going towards your $2,000 annual deductible. Now, it's important to note that preventive care is free to you at 100% covered by the city. There's a website, uhcpreventivecare.com. So it's important to go into that website and look up by your age and gender what recommended preventive screenings there are for you and for your family. If you do go in for one of these preventive procedures, I would encourage you to have the conversation with your doctor up front that it is a preventive procedure so that they bill United Healthcare correctly and that it is paid at 100% and you don't have the responsibility for that procedure. The treatment cost estimator is an important tool to be aware of. Basically, on your member webpage, myuhc.com, there's a button for a treatment cost estimator. So say, for example, your physician recommends that you get an MRI. You can go and view an MRI and the cost they'll be for a variety of facilities near you. Now, you might be surprised to see what the cost variance is for the same MRI at different facilities, but it's important to know that you can make your healthcare dollars go further by selecting the less expensive facilities and just be an educated consumer on what your procedures cost and how they're going to impact you and your family. So I'd encourage you to use that treatment cost estimator whenever possible. The Quicken Health Expense Tracker is a great tool that's also available to you through myuhc.com. It allows you to break out claims across different family members. It explains those claims a little bit better. It gives you the option to pay those providers directly through the website. It allows you to download your claims into a spreadsheet for tax purposes at the end of the year. There's really just a variety of tools. It makes it very user-friendly. I'd encourage you to go check that tool out and sign up for it. It's free to you. If you decide it's not for you, you don't have to use it. It's just an added benefit of being a United Healthcare member. So myuhc.com is your member website for all of your healthcare benefits. So when you get your ID card in the mail, you want to sign up using that ID card. Select the Choice Plus network. Now in myuhc.com, there's a variety of things you can do. You can do anything from view your claim history to check your account balances to find a network physician near you. So I'd encourage anyone who's on the insurance to use myuhc.com. MyUHC.com is also now formatted and available for your smartphones. So if you look it up on your smartphone, it really comes in handy if you're at the doctor's office and forgot your ID card. You can simply pull up your ID card on your phone, show that to them, or even fax or email it to them directly from your phone. Our premium designation program is really a program that we use to recommend physicians to our members. Now when you look up physicians in myuhc.com, you'll notice on the left there's blue stars next to their name. Now what these stars indicate, the first star is basically that they've met quality standards based on national criteria that is not United Healthcare's criteria, but just think of it in terms of them, that doctor's better than 50% of the other doctors out there in terms of the standards they use and the regulations they follow based on national criteria. The second star is an efficiency standard, so that doctor's met criteria based on lower complication rate, lower repeat procedure rates. So we would encourage you to use a 2-star physician when at all possible. NurseLine is a great free service to you and your family. I would encourage you to have this programmed into your cell phone. Basically, you can call up anytime, day or night, and speak with a registered nurse. Now this comes in handy when you or your family are having symptoms of some sort. They can go over those symptoms with you. They can explain what may be going on. They can recommend if you need to go to the doctor. If it's more serious and they really feel that you need to go to the emergency room, they may recommend that. But I would encourage you to take advantage of this service when at all possible and get a registered nurse who has some medical expertise to go over the symptoms with you and what the appropriate course of action is. The Healthy Pregnancy Program is just another one of our free programs available to expecting mothers. Now, this is a great program to sign up for. Just for signing up, you'll get a booklet mailed to you in the mail that basically walks you through the pregnancy process. And there's a lot of tools and resources that engage you as a member in terms of having a successful pregnancy. So we would want to encourage all of our expecting mothers to sign up for this program. Lastly, as a new United Healthcare member, you should be getting a ID card in the mail. Now again, you're going to use that ID card to register on myuhc.com, and you want to take it to your provider and to your pharmacy when you go back in to make sure that they have your most current medical information. So again, this was just a quick overview of your medical benefits for 2012. In your employee package, you'll find many more questions, but if you have additional questions, always contact your HR team. Thanks again.